Hi, my name is Julia Montgomery, and I'm a student nurse at the University of Michigan. This semester, I had the opportunity to interview a patient at Heartland Healthcare Center. I'm going to present this patient to you now. This patient is a 74-year-old Caucasian woman. She is divorced, living alone, non-religious, weighs 206 pounds, and is 5 feet tall. She was a college professor in Florida before retiring, and she now receives financial support from her auto insurance because of a motor vehicle accident that she was in a few years ago. The patient has been under the care of Heartland since this February. She had right femur surgery on February 13, 2015 at St. Joseph Mercy Hospital. She was admitted to Heartland on February 16, 2015 to begin her rehab. The patient was discharged from Heartland in June due to septic shock related to her urinary tract infection, and she was readmitted to Heartland again on June 19, 2015. Her primary physician is Margaret Mackay at the Internal Medicine of Southeastern Michigan, and her primary pharmacy is Heartland Healthcare Services. The patient's vital signs were as follows. Her blood pressure was 118 over 55, her respiratory rate was 24 breaths per minute, and her pulse was 74 beats per minute. The patient's temperature was 98 degrees Fahrenheit. Overall, the patient's vital signs were within relatively normal ranges. The patient's chief complaint was rehab related to her right femur surgery. The patient was in a motor vehicle accident in 2012, which resulted in multiple fractures and surgeries. She had her right femur operated on in 2012 for the first time after the car accident. She had a Pseudomonas infection following that surgery. Last summer, she was recovering well, although ran into complications with the hardware that was installed, causing her to lose balance, strength, and control in her right leg. The patient complained of left femur pain as well, although no complications were found with the hardware upon x-rays and investigation by physicians. A second operation was performed to remove one of the rods that was placed in her right femur on February 13, 2015. After this surgery, the doctor ordered her not to walk for 6 months. To rehab after her surgery, the patient was readmitted to Heartland Healthcare Center. While admitted to Heartland, the patient has experienced some complications related to her joint prosthesis, although she has been steadily progressing through rehab and treatments from her physician at Heartland. The patient reports some abdominal pain due to a medicine that she has been prescribed at Heartland that contains penicillin. Recently, she started having some symptoms of an upper respiratory tract infection. The patient developed a cough, which has been progressively growing worse, and she has been having decreased urinary output due to her dysuria. The patient suffered from septic shock due to E. coli and a urinary tract infection. The patient additionally suffers from persistent diarrhea, although during the interview she states that her current bowel movement is not normal or not different than her normal bowel movement. The patient reports that she was a healthy child, teenager, and adult, although 3 years ago her car accident compromised her health. The patient lost consciousness while driving due to a foramen ovale in the right side of her heart, causing her to crash into a tree. After the accident, she had surgery to close the foramen ovale in her heart and has recovered well. She broke her left and right femurs, her right wrist, and her right heel in the car accident. Furthermore, a portion of the patient's right breast ruptured when she hit the steering wheel during the car accident. She had surgery to fix her left femur, right wrist, and right heel in 2012. After the accident, she lost some muscle functioning, strength, and range of motion, although she is improving daily through exercise and physical therapy. The patient has a history of seizures, although her last seizure was in 2013 when she was at Heartland after a surgery. The patient is diagnosed with type 2 diabetes, hypertension, liver cirrhosis, osteoporosis, and obesity. She is anemic, has dyslipidemia, seizures, leukopenia, hypothyroidism, and depression. She was diagnosed with ductal carcinoma in her left breast in 2013, and it was surgically removed shortly after the diagnosis. In 1991, she had a cholecystectomy. In 1945, she had a tonsillectomy. The patient states that she is allergic to penicillin, graham crackers, and milk. Last time she had penicillin, she reports that she lost consciousness. The patient is unable to drink milk because she is lactose intolerant, and she is allergic to dilantin, cefepime, fluconazole, and trimethoprim. The patient was vaccinated with the influenza virus in September 2012 and 2014. She had her zoster vaccine in 2008, and she had pneumococcal 23-valent vaccine in September 2012. The patient denies any drug or alcohol use, caffeine use, and tobacco use. Currently, the patient does not exercise because of her right femur surgery, which ordered her off her feet for 6 months, although she used to go to the gym before she had issues with the car accident. She mentions that she has home exercise machines and used to work out regularly. The patient does not have any pain or difficulty with sleeping, and because the patient was diagnosed with diabetes when she was 35, she says that she is experienced and knows how to regulate her blood sugar level through taking her insulin and maintaining a low sugar diet. Due to her hypertension, her diet is also limited in sodium, although she keeps her own crackers because she doesn't always like to adhere to the diet that Heartland Healthcare Center provides her with. The patient drinks sugar-free soda pop daily, and the only other thing that she consumes is water. The patient grew up with 4 siblings, and only 2 of them are still alive, although her sister lives in California and only comes to visit approximately once every 2 years. The patient was married at age 25 after dating her husband for 8 years. After 10 years of marriage, the patient divorced her husband because he cheated on her with her best friend. She gave her child up for adoption, which she had when she was 18 years old, through an affair with a married man. Her daughter is now a 45-year-old woman living in Texas with 3 daughters of her own. The patient lives alone and says that she is happy with her situation. She has 2 friends who she often sees on a regular basis throughout the week. She is non-religious because she says that religion is not a necessity to her anymore. She got her PhD in child development and statistics at the University of Florida. Her family history includes her mother's death of a heart attack, her grandmother and her sister both having breast cancer, and she was also diagnosed with breast cancer herself. As soon as the breast cancer was discovered, the mass was surgically removed, and the patient states that she is fully recovered from her cancer now. The patient has a family history of diabetes. Her mother, brother, and sister also were all diabetic. She was diagnosed with diabetes when she was 35 and denies any other family history of chronic illness. Her general review of systems is as follows. The patient is alert, awake, and aware of her surroundings. She speaks clearly and concisely, although she does suffer from the early stages of dementia. She is properly dressed and has good hygiene. She denies any pain aside from her dysuria related to her recent septic shock. She has not suffered recently from any nausea or vomiting. Due to the patient's multiple fractures related to her car accident, I decided to perform a musculoskeletal assessment. The patient reports that she has no numbness, tingling, or issues with maintaining balance. She has no swelling, pain, or crepitus in her joints. Her muscle tone is symmetrical, and she has no cyanosis or pallor. The patient's spine is midline. She displays full range of motion in all of her joints without pain. Her joints are without inflammation, erythema, or crepitus. She could not fully extend her right knee or her right hip due to her accident and her operations. All of her muscle strength is a 4 out of 5, aside from her right hip and knee, which are rated as a 3 out of 5 due to her decreased strength and range of motion related to the accident. She had to stabilize herself using the bedside table while doing range of motion in her hips and her legs. I decided to perform a cardiovascular assessment due to the patient's history of cerebrovascular accident and her type 2 diabetes and hypertension. She was diagnosed with type 2 diabetes at age 35, and her last seizure was in 2013 after her surgery. The patient had a foramen ovale in her right side of her heart, although she has recovered well since her surgery in 2012. No pulsations were noted upon inspection of the chest and abdomen. S1 and S2 were audible, and there were no murmurs. No S3 or S4 were audible upon use of the bell. No heaves, lifts, or thrills were palpated over the cardiac landmarks. Points of maximal impulse palpable at the fifth intercostal space and midclavicular line. 1+ edema was noted on her right leg, and capillary refill is less than 2 seconds on all of her fingers.